case module discussion. So today I'm going to take a different thing, like this is a true cut biopsy of a renal parenchyma. I'm sure you must have noticed that, right? You can see the tubules and you can see the glomeruli as well. Kidney reporting is very, very special. You have to be trained by a specialist nephropathologist to know exactly what to report and how to report. While going on to the detailed discussion in our regular course, I'll definitely go what all pointers to look for, because in a kidney biopsy you have to mention that how many cores are present first. Second, you have to mention the number of glomeruli in each core, and the number of stroma and the number of tubules, and then what is the problem with the glomeruli, right? And then with the tubules, and then with the interstitium, and you'll have multiple stains. It's not only H&E, you'll have PAS, you'll have Jones, and immunofluorescence as well, right? So I have two images here, one of the H&E and one of the PAS. I don't have IF because like IF cannot be stored. So I cannot retrieve them. But I have the report of the IF. I'll definitely share with that to come to a final diagnosis, right? Okay. Having said that, now if you look at the glomeruli, see here this is a part of. Let me zoom it a little bit. I'm sure that this part is a glomeruli, but something wrong is happening here. It might be very difficult for me to go and say what is the problem here. So I'm just going to search for another glomeruli where it's easy for me to say what the concern is. Look at this glomeruli. This is beautiful, right? I'll zoom into this even more better. So if you look at this glomeruli, how to describe this? The glomerular capillaries are decent and the glomerular capillary lumen is not having any amount of inflammation. But what's happening is, in the Bowman space, something is protruding from the Bowman space, right? You must have definitely read about multiple things in glomerulonephritis. You must have definitely come across something called as a crescent. This is actually the crescent. You won't expect crescent always in the crescentic form. Crescent is something which is going to be there in the Bowman's capsule coming from your membrane, right? If you see this, these are nothing but your parietal epithelial cell hyperplasia coming and compressing the glomeruli. That's one, right? Now with this information, let's go and look at this glomeruli again. Look at this glomeruli. This is the capsule. Everything else is compressed. So can I call this a beautiful crescent? Yes. So as a pathologist, when you compare the crescent, you have to say whether it's a fibrous crescent or a fibrocellular crescent, because that also makes sense here. Here, I do have half of them. It's more of acellular area, fibrous, and here I do have cellularity as well. Look at this. My glomerulus is here. It's only in one pole. Rest everything is replaced by cellular crescent, right? Because like I said, that also makes very, very important in the final outcome, and nephrologists would want that, right? Let's see and go and have a look at other crescents, other glomeruli if I have something. I do have a glomeruli here. You can look at it, and a little bit of fibrous area is there. Maybe a fibrous crescent there. Again, something is compressing here. A completely crescentic glomerulus might be very difficult sometimes to interpret. This is a normal glomeruli, only half is there. So I'm not going to comment on that, right? So here, look at this. You have a glomeruli which is completely gone, right? The entire glomeruli is completely filled with crescent. That's what a clear-cut crescentic glomerulonephritis will look. It's completely gone. These are also glomeruli, completely gone, right? So if you look at the PA section of the same, the cut half of normal glomeruli, let's see if we can identify crescent. See beauty. In a PAS, the utility of special stain is that you can see exactly the tuft of glomeruli which has been compressed, and on the top you have a beautiful crescent. Look at this. You have a crescent which is compressing the glomeruli. That's the utility of special stain. It's not just for coming out to some diagnosis, and also you will get multiple sections here. You can see an entire glomeruli compressed by something coming from the parietal epithelium. That's a crescent, right? Here again, see beauty. You have a crescent. It's predominantly a fibrous thing, right? Okay, so when you have a crescentic glomerulonephritis, if you're finding it difficult to pick up the number of glomerulus on a normal H&E, I would say go for a PAS. Because in PAS, you can identify even if a full glomeruli is complete by crescent, you can still pick them up as a glomeruli, right? So it's always useful. Look at this. You still know it's a glomerulus. You might have missed this glomerulus on a H&E, but in PAS, you can see the outer membrane as well. And this glomerulus, I have the tuft of capillaries here. Again, completely gone from this side. From this side also is gone, right? Again, completely gone. So this is a clear-cut case of an RPGN or a crescentic glomerulonephritis. You have to do an immunofluorescence to give a report, because RPGN has 3 categories, and this category, the immunofluorescence was negative for C3, your C1b, your IgG, A and E. Everything was negative here. So we reported as in posse-immune glomerulonephritis, the type 3 crescentic glomerulonephritis. Fine. So thank you for your time. I'll add a little bit of information in the fact sheets, and hopefully we'll learn more together. Thank you. Bye-bye.